Bismillahirrahmanirrahim. The secretion, metabolism, and chemistry of the male sex hormone is discussed in this video. The interstitial cells of the leg are the cells that are responsible for production of the testosterone. Testosterone is the primary uh, hormone and it is most abundant hormone, and in the target tissue it is converted into dihydrotestosterone and androstenedione. This dihydrotestosterone is more active form that is derived from testosterone. The interstitial cells of the leg, they are present in the spaces between the seminiferous tubule, and they comprise about 20% of the adult testicular mass. During childhood, there are very few Leydig cells present, almost responsible for no testosterone in the childhood. But there is a newborn period during which numerous Leydig cells are present, so there is short burst of testosterone secretion. However, after puberty, the testosterone level is increased due to abundant Leydig cell. There is gradual decline in testosterone production in the old age, and this secretion of this hormone is increased due to tumors of the Leydig cell. These cells are not damaged by the X-ray and heat as the seminiferous epithelium is damaged, so they are slightly uh, more resistant to the radiation and heat. So due to the heat and X-ray radiation, these Leydig cells, they survive. However, the sperm production is impaired and these Leydig cells continue secreting testosterone. So the Leydig cells are the testosterone producing factories in the testes. They are active at birth and during adulthood and regulated by life stage and pathological condition. Even if the sperm production is impaired, testosterone secretion may persist. This illustration is showing the interstitial cell of the Leydig, the cells that secrete testosterone that are located in the interstitial spaces between the seminiferous tubule. They are the primary producer of the testosterone, the dominant male sex organ and hormone, and they are morphologically large cells with abundant cytoplasm and central nuclei. Then the blood vessels are also shown in this illustration. The supply of oxygen and nutrients, and this also carry the testosterone from Leydig cells to the body. Then the proximity of the Leydig cell with the vessels facilitate the hormone release into the circulation. Then these green cells, they are fibroblasts. They produce the connective tissue fibers and support the structures between the tubules, and they also found in the interstitial space. Then these orange cells are the germinal epithelials lining the tubule, and these cells line the seminiferous tubule and responsible for spermatogenesis, the production of the sperm, and there are also Sertoli cells and developing sperm cells at various stages. So Leydig cells secrete testosterone in response to the luteinizing hormone. This hormone regulates the development of male reproductive tissue, spermatogenesis, and secondary sexual characteristics. Androgens are male sex hormones that promote male secondary sexual characteristics. Any steroid hormone that has a masculinizing effect is termed as androgen. The main androgen is testosterone, but other include androsterone and dihydrotestosterone, dihydroepiandrosterone, and many others are also there. So other source of androgen beside testes are also present. One is adrenal and gland. So there are 5 types of androgens that are produced from adrenal gland. They account for less than 5% of total androgenic activity in adult male, and their effects is minor in males. In female, then can cause the growth of the pubic and axillary hairs. Tumor of the adrenal cortex will result in masculinizing uh, even in female. Then tumors of the ovary or embryonic rest cells in the ovary, they also result in excessive quantities of androgen in female. Areninoblastoma is a rare tumor from the embryonic crest cell that secretes large amount of androgen, and that will result in male features in women. Normal ovaries, they produce minute androgen quantities. They have got no physiological significant activity. So an adrenogenital syndrome can cause viralization in female, precocious puberty in boys, and androgen secreting tumors are diagnostic concern in females that are showing male traits. All androgens have got a steroid nucleus that is derived from the cholesterol. They are formed directly from acetyl CoA, and these biosynthetic pathways occur in testes, especially the Leydig cell of the testes and adrenal gland. And this cholesterol is the main precursor of all steroid hormones, including the androgens. There are 2 of these. One is testosterone and another is the dihydrotestosterone. The testosterone has got a steroid nucleus with a hydroxyl group on carbon 17 and keto group on carbon number 3, and it is the primary male sex hormone that is produced by interstitial Leydig cell of the testes and responsible for the development of male reproductive tissue and the secondary sexual characteristic. The dihydrotestosterone has got the similar structure to the testosterone, but with 2 additional hydrogen bond. The reduced double bond in the A ring. In this A ring, in testosterone there was double bond. Here this double bond is absent, and there are 2 additional hydrogen atoms are present, and this is derived from this testosterone by the enzyme 5-alpha reductase. This dihydrotestosterone is more potent than testosterone, and it is important in the development of male external genitalia and prostate, and also affect the hair and skin growth. The key differences in both of these hormones, the testosterone and dihydrotestosterone, is that this testosterone has got a double bond between this C4 and C5, while dihydrotestosterone makes this double bond. It is fully saturated structure in that region, and this makes dihydrotestosterone more stable and biologically active at the androgen receptor. The testosterone that is produced from the testes, 90%, 97% of this hormone is bound to the plasma albumin, and this binding is loose, while 3% of this is bound to sex hormone binding globulin, and this is biologically more active, and circulation time of this is about 3 minutes to several hours. And after circulation in the blood, it is either taken up by the target tissue or it is degraded into inactive products. So, in many target tissue, such as prostate, external genitalia, the testosterone is converted into dihydrotestosterone by the enzyme 5-alpha reductase, and DHT is often the active form in those tissue with a stronger androgenic effect than the testosterone. Then the inactive testosterone that is degraded into metabolites and it is converted in the liver and excreted in the urine and feces. So the testosterone in the tissue, in the target tissue, it exerts its effect, while the unbound testosterone that is not fixed to the tissue is quickly metabolized by the liver and it is converted into androsterone and dehydroepiandrosterone. And there is conjugation of these metabolites, and these are conjugated to improve the solubility. These are conjugated with the glucuronides most commonly and sulfates, and then they are excreted via bile into the gut and moves out of the body through feces, or they cleared away from the body through the kidney and excreted in the urine. So estrogen is also present in male, and but its quantities are very less. So about male produces about 20% of the amount of estrogen that is found in non-pregnant female, and this estrogen is detectable in male urine, indicating systemic presence, and this estrogen is also present in seminiferous tubule, and it is produced by Sertoli cells. And Sertoli cells, they convert testosterone into estradiol, and this estrogen in this seminiferous tubule, they play an important role in spermiogenesis, the final maturation of the sperm. Then there is peripheral conversion also. The main site is the liver and other peripheral tissue, and the precursor are testosterone and androestradiol that androstenediol that are converted into estradiol. So the peripheral tissue convert these androgen into estrogen. And this process accounts for about 80% of the male estrogen production. Testosterone is the main male hormone, and its timeline for the secretion differs during the phases of the life. So during the fetal life, it is produced by the action of HCG, and this HCG is then responsible for the moderate production of the male sex hormone that is responsible for male differentiation. So after birth, there is continued influence of this HCG. So for a short time, up to 10 weeks, there is release of this testosterone that ceases during childhood. After 10 weeks, it ceases. Then during 10 to before 10 years, there is no testosterone, while in the adult life or puberty, due to stimulation by gonadotropic hormones from the anterior pituitary, there is maintenance of high level throughout most of the life, and beyond age of the 50 there is gradual decline in this secretion, and by the age of 80 the level drops to 20 to 50% of the peak concentration of the testosterone. This hormone is responsible for masculine characteristic growth of body hairs such as face, chest, and pubic region, deepening of the voice due to laryngeal growth, muscle mass increase, density of the bone and size of the bone, libido and male sexual behavior, and spermatogenesis. This graph is showing the lifespan pattern of plasma testosterone level and sperm production in males. On the y-axis, there is plasma testosterone level that is expressed in nanogram per ml, and this scale is from 0 to 6 nanogram per ml. The right blue line on this y-axis is sperm production percent of the maximum, and it is expressed from 0 to 100. On the x-axis, the timeline is divided into four major life stages: the fetal by trimester, first, second, and third trimester, neonatal period, prepubertal period, adult period, and then old age period in years. So specific years that are labeled are 1, 10, 17, 40, 60, and 80 years of the age. The red line is showing that this plasma testosterone in the first and second trimester, there is sharp rise into testosterone peaking up to about 5 nanogram per ml, that is essential for male genital development, and after birth another temporary rise occurs, then a sharp drop. In the childhood, this level of the testosterone is very low, almost negligible, and around the 10 to 17 years of the age, around the puberty, the level of the testosterone then peaks again to the 5 to 6 nanogram per ml, and during the adulthood of the 17 to 50 years, this level is high and stable. There is gradual decline after the age of 50 in the testosterone level that goes to about 2.5 nanogram per ml by age 80. The blue line that is showing the sperm production begins to rise around the puberty or at the age of 13 to 17 and peaks in early adulthood and aligning closely with the peak testosterone level. There is gradual decline in this sperm production after the age of 50, but remains above 50% of the maximum in old age. So testosterone level surges twice early in life, during fetal development and during this fetal development and during uh, or shortly after the birth. Puberty triggers long-term elevation in the testosterone as well as the sperm production. Both decline gradually but not abruptly, explaining continued male fertility potential into older age, albeit it is reduced. Thank you for watching this video. If you have any query, please write in the comment box.